Earlier, it's a little bit of a who is BlueHive. Well, let me first tell you the story of MIE. So we are a company of medical informatics engineering. So MIE was founded in 1995 by Doug Horner. His ultimate goal was he wanted to make the lives easier for doctors so that they can spend more time with their patients and less time wrestling with software. We're doing a little bit of a survey. We wanted to figure out which resonates the most. So usually if you're in that, you sort because we're new, we want you to understand we've been in this space a long time. The medical space, the medical industry, and then also helping HR specialists, HR journalists, HR directors. BlueHive now is built to service the market that's below 15,000. So what we quickly figured out was this market is severely underserved. Most of the time in my research, you're using a platform that the provider's given you that can be clunky or sometimes just hard to use, or you're quite frankly just using spreadsheets, fragile networks of relationships, and really tribal knowledge of the HR person who's capable enough to keep it all together. So just like this space is evolving, evolving quick, We are the technology space is evolving quick to the standpoint where you really have a platform to do everything. So it was quite a shock that there wasn't really an effective platform from my standpoint to service that. So we are built to service anybody from as small as less than 50 employees all the way up to 15,000. We have a pricing strategy for anybody, so you don't even have to pay us a monthly fee to start using us. That's going to be important later on down the road because we're going to have an audience participation part in this. So the purpose of the event, threefolded. One is the drug screening challenge. So this is truly a challenge. I'm going to build up some anxiety here. Okay, we did this rehearsal, and I'm just going to be honest. There were some times we did not get it done in 60 seconds. So what are we talking about in 60 seconds? What we're going to show you is if you're never a client of BlueHive, you're going to be able to onboard your company in less than 60 seconds and also schedule a drug screen. So not just onboard, schedule. So the difference, again, call into our sister company, Enterprise Health. To onboard a client there takes somewhere between, well, the sales cycle takes 14 to 18 months. And then once you're signed on, it takes a few months to onboard because there's just a lot to consider. So we're the opposite. If you see us in a commercial and you're interested, you should just be able to put your credit card in there and onboard right away and try it out. There are no contracts, no strings attached. There is not an extensive integration. I wouldn't even call it integration. You can import your employee roster into BlueHive and start using it right away. So to me, that's very important because if you decide, hey, this isn't for me, you simply shut the proverbial switch off and there's no harm, no foul. So I really think that's kind of a big selling point for BlueHive. Again, when I've witnessed Enterprise Health, there's a complex sort of approval process typically everyone has to go through, and we're trying to eliminate all of that. So let me just ask this real quick question before I have Chris play the next video and then I bring up Will. How many people are doing drug screens today? Okay. May I ask someone to volunteer and let us know how you're actually doing those drug screens now? Like, how are you scheduling it? Brittany, do you mind? She does them in-house. Okay, so you actually have kind of a clinic to do it, and you do it all there. Anybody else? Okay, so then when that's invoiced, how does that come back to you? In an email, in a fax? And then how do you keep that in a record? Do you have to keep the records there, file it away, or how do you keep track? Okay, but you have to manually input that. So the beauty of BlueHive is it's all in BlueHive. So everything, the communication, the scheduling, the invoicing, and quite frankly, the record keeping. So Jake, I'm going to sort of talk about you. So Jacob works for Blue Jacket, which has a great mission, which is to help anybody who has unfortunately gone to prison to come back and work or be someone that can be hireable. And what that means is he does quite a bit of drug screens. So typically a company of his size isn't going to be able to afford the type of platform that we can offer. But because, again, we're positioned to really price you at any capacity, it's really to try to match your budget. He's now able to do all of that in one space. Does anyone do background checks? Okay, so again, back to our mission of putting it all into one platform. We actually have Checker integrated, so if you do any type of Checker background checks, you can just do it right through our platform. You're actually not paying us. You're still keeping the same relationship with Checker. You're just, again, keeping it all in one platform. And that really goes to the same mission Doug had, which is keep doctors' lives less stressful so they can concentrate on patients. For BlueHive, it's keep the HR professionals less stress on dealing with clunky software. So BlueHive is there to keep everything in one platform. The beauty of us being part of a technology company is we can respond quick. We're in an early stage, so if you are a client of ours, we can start to, now, within reason, we are going to respond to the market in a way that tries to, again, make your life more seamless. And so if you become a client and you're like, hey, this would make my life easier, we'll definitely research it, make sure it actually applies to everybody, and you could see that feature in the next 2 weeks. Sorry if I'm over-promising on my development team. All right, so with that said, Chris, if you don't mind queuing up the next video.
What could you do with 60 seconds? In just 60 seconds, you could do a lot. Maybe brew a cup of coffee. Smell the roses. Finish that crossword puzzle. Or listen to that new song one more time. And now, with BlueHive, you can check drug screening off your to-do list just as fast. No lines, no clipboards, no chaos. Just fast, secure, 60-second screening from a network of over 18,000 providers. Because compliance shouldn't slow you down, and your time matters. Join us at BlueHive for the 60-second drug screening challenge to learn how you can simplify occupational health. With BlueHive, HR just got easier. See, in the time you watch this video, you could have already scheduled a drug screen for your entire team. Here's how.
All right, so the moment you've been waiting for, so before I say this, we're gonna do this drug screen challenge, and you're gonna see it he's gonna whip through it pretty quick because he's trying to do it in 60 seconds. But then after that, he's gonna do a step-by-step walkthrough. He'll do a presentation just explaining all the features and what comes with it, and then he'll do a walkthrough of the actual application. So I'd like to introduce Will Reisky. He's a co-founder and he's our Chief Technology Officer. And like I said, this is not a given, so we're all nervous. I'm nervous. I don't know about you guys, but Will, tell me when you're ready and I will cue up Chris.
I think I'm ready to go.
All right, let's go.
All right. All right, so I'm going to go ahead and onboard an employer here as Electric Works. If you notice, a lot of the information was automatically filled in, so that's something cool. I'm here today for drug tests. We're doing this at an event, and I'm going to import from Bamboo HR. We support up to 200 plus HRIS systems that you can just easily onboard. I'm going to type my credentials in, check them in right the first time. Bingo. And now it's going to import those employees. I got 20 employees imported. I'm going to set up my payment information. I'm going to use my state company card here. Let's go next, and I'm going to start my first order. I'm going to go in here to this employee's chart. I'm going to do a 10-panel drug screen. And I'm just going to select the nearest provider to the employee and send the order. With 12 seconds to spare.
Anyone.
So it's that simple. So I'm going to introduce BlueHive a little bit. You already sort of introduced BlueHive, but I'll talk a little bit more about the background of the provider directory and how we got to where we are today. And then I will go back through the ordering workflow. So the ordering workflow that you saw within 60 seconds is, there's a lot more to it. You can, do bulk orders. You can select, I only want people in accounting to get this drug test. You can do recurring things. So I'll go through and really walk through the entire product so that you can see step by step how to do it. And then at the end, we're going to talk about the $1,000 giveaway. So stay tuned for that. One of the things that we have been trying to do within MIE as a whole, like we said, we have MIE at the top, and then we have BlueHive, WebChart, Enterprise Health. MIE has been around since like 1996, and we have been trying to make a dent in healthcare. So what is healthcare, right? There's a lot to that, but specifically occupational health is BlueHive's focus. So anything that you would need if you have truck drivers and they need DOT physicals, if you have factory workers and they need hearing tests or OSHA compliance, that's BlueHive's focus. And in 2018, we started out just as a directory, just a list of providers anywhere in the United States that can do an occupational type service like a DOT or a drug test. And we started using something called the NPI database, National Provider Index, I think, where basically if you're a registered provider, you're in the NPI. And actually Evelina, our director of marketing over there, started this team, and we imported about 3,000 providers. So 3,000 of the people from the NPI, what would you say, 70% of them were bad, 60% of them were bad? So she manually went through every single listing, and it was like a boarded up building on Google Maps, or I retired, I don't do flight physicals anymore. So we quickly realized, okay, we need to build a team. We need to build a team of people to go through this directory one by one and keep it up to date. So that's how BlueHive started, is literally just data entry people going in, finding providers anywhere in the United States that can do these services, and we built out our directory. So that was 2018, 2019. After that, COVID came around, and we partnered with a provider, Work Health Solutions, that allowed us to send out COVID-19 tests through our platform. So we actually, built out our employer offering for that provider to give them access to provide those services to employers. So around, whenever COVID hit, we actually onboarded Adobe and Twilio and Intuit, some of these large employers, and they had their employees using our platform to order at-home test kits. And our platform did the entire life cycle of the order. So ordering the test kit, FedEx overnighted it to them, they did it, it was returned FedEx all the way back, and then all the digital results came back in. They got a text message, an email that their results hit, and then also all of the reporting, right? So if you're a manager and you have somebody that had a positive result, you need to know about that for them to be able to, not come back to work. And then we also need to provide the return to work for them. So we went through that phase of, just building that out for them. And then we started to focus here recently within the last, I would say about a year, on specifically a go-to-market strategy for drug testing and background checks. Because there's a lot of things that, if like Rocket Mortgage and their advertising, it's the quickest way to get a mortgage, right? You hit the button and you've got a mortgage. That's kind of what we're doing with BlueHive right now. We've got an expansive directory, all of the United States. We have 20,000 providers now, and I'm confident in saying we have the most accurate and up-to-date directory, and we have the easiest platform to be able to order these drug tests. So the BlueHive solution, I've talked a little bit about the employer side. That directory of 20,000 providers, we also have a platform for them. So we have a completely integrated solution between the employers and the providers, which, what does that mean for an employer? What does that mean for you? That means that you are going to have a seamless experience anytime you're ordering a test. You don't need to call anybody, you don't need to send a fax to anybody, you don't need to set payment information up. We have providers in our network that it's all digital. So all of your invoicing, all of your receipts, all of that goes through the platform, and there's no need to call them in 3 days, hey, where's this result at, right? We handle all of that for you because we have partnered providers in the directory that use our platform as well. And then we also have an offering for employees and individuals. It's optional, if you want to be able to allow your employees to log in and see their recent tests. Like if you're a truck driver, you'd be able to log in and see your DOT, last time you had a DOT. So I'm going to talk a little bit about the employer offering. We've built this platform to try to efficiently manage the occupational health needs of employees and give you that directory of the 20,000 providers. And a lot of our focus recently has been on that streamlining for scheduling and tracking the employee exams. We want to give you the most visibility possible so there's no questions of, have they gotten tested yet? Where's this result at? Is it paid for, right? And a lot of times, you'll get through the testing process. A provider might send you an invoice in the mail. It's like, did I already pay this? Have we already done this? This simplifies all of that for you. Oh, and then it also shows the full concierge services, which I'll get into a little bit later. Again, provider solution, we've just got a lot of providers. We have a solution for them that connects up with the employers, so I won't talk about that too much. Within Fort Wayne, I can't remember how many providers. It's about 70 providers, I think, that we have in the Fort Wayne network. So if you look at the map here, this is all of the providers that we support in Fort Wayne. If there's a provider that's not in our network, it's pretty simple for us to get them in the network. So if you onboard and you say, well, I always go to, well, we have like all the Park Views, all the Ready Meds, all the, but if you say, oh, I use this urgent care and they're not in the directory right now, our provider team will come in, onboard them, make sure they're fully onboarded so that you can use the platform, and the provider will, get the payments and everything through the platform. Yes, so we talked a little bit about the employees, giving them access. Here's some of the features in the platform. We easily import from any HRIS system. We also support CSV imports and obviously manually importing. So if you just want to add an employee, whether you're on the field with your phone or you have your desktop or a laptop, it's really simple to get data in. And then those employee rosters can also automatically import nightly. So you can go in and let's say you just hired someone, you just added them to Paylocity or you just added them to UKG or something. You could go in and hit the update button, which I'll show how that works. And it'll bring the latest info in, but it will sync nightly. So if you add an employee at 5 o'clock, by midnight, they'll be in there for the next day. And we can also do automated testing and things like that. So if you have someone that's a new hire and you want anytime a new hire gets onboarded to get a 10-panel drug screen, we can automate that process as well. So you don't even need to go into the application. It's just add them to your HRIS system, mark them as hired, BlueHive handles the rest. Order creation process, we'll talk about that, and I'll go through the demo. And we also support single sign-on. So this is an important thing for some employers. If you have, you log in with Google or you log in with Okta or you have a single sign-on, and that doesn't cost any extra. Some platforms, you got to have like an enterprise plan and you got to have an agreement with them and set up the back and forth for the single sign-on to work. It's part of our platform, so you can set that up. I already talked about the provider directory, service management, and the simplified invoicing we'll go into later. So this is our services. I think this is definitely not our full service list, but this is a subset of some of the most popular services. We've already talked about DOT physicals, you're here for drug screening. So this is a list of some of the services that we do. There's also booklets that are somewhere on the tables. I see some of you have them. Everyone should have one. If you don't, we might not have enough for everybody, but if you want one, we will get you one. And we can also send that in an email for you. But that will also have some of the services in there. If there's a service that you think of that you're like, well, do you do this and it's not on the sheet? Yes, we can figure it out. Any occupational health service that's needed for you to be able to manage your employee population, we will make sure is in the platform so that you can do what you need to do. Awesome. So BlueHive for employers. Again, we can import the employee rosters. You can select what employees you want to order tests for. You can choose multiple services. So if you have an onboarding package, let's say anytime you onboard a truck driver, you need a DOT physical, you need a 10-panel drug screen, and you need a background check. We can bundle those together. And again, in that automation from your HRIS system, you can say, okay, anytime I onboard an employee, give them this bundle. And you don't have to do anything. It just fires off the background check and fires off the drug screen and does all of that for you. Onboarding is really simple, and I'm going to go back through this. You saw this in the beginning of the 60 seconds. So in that 60 seconds, I filled out an employer name. It auto-populated the address info. So if you have a business that's on Google Maps, you probably all do, it will automatically fill a lot of that information in. Just double check it. Sometimes Google Maps info is outdated if you have a new email or a new website or something. And getting onboarded is like literally 3 clicks to get on. And then from there, you can add all of your employees to the roster, CSV import, which I will talk about, and we'll go through that. And then, the simplified service ordering, it's as simple as selecting the employee, selecting from which service you want to do, and then selecting a provider that's near you. Now, part of the provider selection process is we've built out this thing that we're calling the concierge. So our concierge, if you give us the authorization, you tell us what providers you like, and then we will automatically choose the provider that's closest to the employee, and we will handle that for you. Now, there's an important piece of that we can't direct care, so we can't say, like, go here, but if you tell us, like, use these park views or use this ReadyMed, we can go through that list for you, and you can just say, this guy needs a DOT physical, this guy needs a drug test, and we will handle everything. We will handle finding a provider, we will handle the scheduling, we will handle making sure the employee goes there, we will handle getting the result back. So you just say he needs a drug test, you step back, and we do the entire rest of the process. Yes?
So if an employee doesn't go, you actually get on the phone and call them and say, why haven't you gone yet?
So there's a piece of that we don't necessarily handle the logistics of, like, why didn't you go do this? But we can at least handle making sure that it gets scheduled, making sure that they got a text message that they were scheduled to go, and then if they're a no-show, that's really, that's up to you to handle that. I don't know if we want to get in the business of handling that piece of it.
That's why I asked for that clarity.
Yeah.
That's what
Definitely
it
not.
sounded like.
Yeah, definitely not that piece of it, but yeah. Good question. ACH and card payments, we have several different methods of like actually having you pay for the services. So if we're in an agreement, which we don't need to get into an agreement, but if you need just like a net 30 or a net 60 invoice, we can do that. Otherwise, it's just put in the credit card or put in an ACH, and it'll just bill based off of the services every 30 days. So you'll receive an invoice, it'll just auto bill, and you're good to go. We have a couple different pricing tiers that we can go into, but what I'm going to do is I'm going to hop out of here, and I'm actually going to show the product. So here we are from earlier with that demo system. And I'm going to move over here to Consolidated Manufacturing of Indiana. And as you saw this onboarding, this is what it's going to look like when you first start. This is really for our marketing team to know, like, how did you get here? What do you need? So that we can make sure that our development team and our marketing efforts essentially are focused on the right things. So come in here and look through the options. If you're here for drug tests, select drug tests. If you're here for automated health screenings, select that. And then just go through this process. So how did you hear about us? We're here for an event today, and then going through the onboarding. So this is a list of like 200 plus HRIS systems. So we support UKG, I believe Paylocity's in here, ADP, if I can spell, that'd be great. Bamboo, some of them, mostly all of them. If there's a system that you don't have, we can upload through CSV. And the way that this works is if you have an export out of your software, it doesn't matter what format it is, as long as it's a CSV. So the fields, sometimes you get an import where you got to have first name as first name, you got to have last name as last name. Doesn't matter. We can support any format and get data in very easily. And like I said, you can also manually add an employee. And this is what that process looks like. Okay, so from here, now that we already have data in, I showed adding in a credit card. It's that simple. Add a card in this way. If you have a bank account, you can add it in this way. The bank account takes, I think, 24 hours because it'll send, or I mean, it could take longer than that. The bank account verification, usually what it does is it deposits like 10 cents or 15 cents into your account, and then you come back in and verify that information. So if you are adding a bank account, it might take a day or two for the back and forth of the ACH to verify. And then I'll just skip these and we will get into the product. So this is the product, this is the dashboard, this is what you will see when you log in. From here we have a couple different things. Mostly what you'll be doing are in the top 3 areas. So you'll have, you've got your dashboard, orders, and employees at the top. So from here we can go into the employee directory. You can see all the employees here. The Wi-Fi here is a little slow, so that's why these are taking a minute to load. But then you can go into these employees and see, okay, this guy doesn't have any orders. We haven't done any background checks for him. So let's go ahead and create a new order for him. So within our service list, we have a bunch of different services. You've got all these labs and screenings and titers and vaccines, substance abuse. So here's a lot of our different drug tests and things like that. Oftentimes I just go for the 10 panel because it's the most complete that we use for our onboarding for our employees because we have government contracts and it's required. But you can come in and select, if I wanted to do a DOT physical 2, I could do that, or I could remove it. And you can just select the different services that you want from here. So once you have a service selected, you just hit next, and this is where it selects the provider. Now, if your employer organization is, I'm assuming everybody's headquartered in Fort Wayne, right? No. Okay, where are you at? Auburn, perfect. So if you're, like when you come in and you add your employer in, it will say, what the address is, whatever your postal code is. If you have an employee that's not actually in Auburn, let's say they're a remote employee in California or something, the way that this order process works is it's based off the employee's location. So if you look over here, you'll notice that his postal code is 47980. And what we do here is we find providers that are closest to that postal code. So if you come in and you're confused why it's 20 miles away, it's because it's the closest to the employee, which is optimal, right? If you're trying to hire someone for a test, you want it to be the closest possible for them. So okay, I'm going to select this 10-panel drug screen. and you'll notice I've got all the services selected. If you had multiple services, that's where it would say, hey, you've got, the DOT is unassigned, you got to select a provider to do that. And then I'm just going to hit send order. And that's it. It's getting fired off. The concierge team has just got a notification. Somebody's calling the provider confirming, hey, we've got an employee that needs a 10-panel drug screen. If we've already got an agreement with the provider, it's not even a phone call, it's just automatic. They get it, it's ready to go. And then they will confirm it. If needed, the employee will get a notification for consent. Depending on the provider, sometimes they need a consent before they go. If there's any pre-authorization forms, that will all be communicated with the employee that they need to sign and bring in with them. Oftentimes it's just a digital email, and they can just sign it before they go in, and they're good to go. And then the employee will go in, they will do the testing, and then all of the resulting and everything will show up here. So that's the ordering process. We also have the ability to do bulk orders and different things like that. So if you do have an organization, this one's not set up for bulk ordering, but if you have a list of employees that you just need to get ordered, you can go in and select multiple employees and send off like a 10-panel drug screen for all of them. So any questions on that so far? Yes?
Can you change the location
Yes.
for so I've got an employee who lives in Fort Wayne, has an accident in Whitley County. I can schedule them for occupational health overload.
Yes. Yep, absolutely. Yeah, so right now the easiest way to do that is going to be going in and editing the employee and changing the postal code. We have a way that's in development right now so that when you're doing the order, it will pop up, to change the postal code for the search, so you wouldn't even need to edit the employee. So this would be a workaround to make that work if they were, physically in a different location. Yeah, and a lot of this is auto-completed, so if you go in here to the address line, like we're at, 1690 Broadway, you'll notice that it uses the Google Maps autocomplete, which some of you are probably familiar with, and it just autocompletes all the information for you. But again, 99.9% of the time it's perfect. Sometimes, it might pull in the wrong postal code or something, so just spot check it with your eyes before you hit save. We also have the ability to add additional information for employees. So if there's something important that you need to track, like a department number or something internal that you need to know, okay, well, this employee is this, you can come down here to the employee information, and you can say something like, is cool, yes, and you can save that information. And then if we go into Michael Booker here, you can see he's cool. So all that extra information you can track on there. Cool. All right, so then here's some of the pricing. We have an entry plan that is free. You don't pay anything, and there's a 40% transaction fee on the orders. So the way that works is if there's a $100 drug screen, we would have a 40% transaction fee for that. Free to start, and it's easy to onboard, which we're going to show you guys that full onboarding process and actually walk you through it. We're going to have a challenge, I think, here in a little bit to do that, where whoever is the quickest to onboard, gets a prize. And then we have several plans on top of that. So we have the small business plan, basic, growth, and premium. So depending on your order volume, if essentially you can commit, well, we're going to need 500 plus orders a month, you will have significant savings on that transaction fee. It goes all the way down to 2%. So there's no contracts. Again, this is an easy process. You can onboard and offboard anytime. Your data is protected. We have our parent organization hosts over 500 million medical records for some of the largest employers in the world. We have people in 60 different countries, where some of our clients are, Disney, Dow, Eli Lilly. We've just recently signed the Veterans Administration, so we have some of the largest, Fortune 500, Fortune 100 employers in the United States that are using our platforms, hosted out of our own data centers. So everything that we do, we actually have a data center in Fort Wayne. We have a data center in Indianapolis as a disaster recovery data center, and then we have a data center on the West Coast in Phoenix. So the way that works is we fully own and operate all of our hardware, all of the SOC 2 high trust certifications. We have all of HIPAA, everything that you need to make sure that your data is safe and secure. And when you if you decide to offboard, all of that data is scrubbed. It's completely gone. So no issue getting in, no issue getting out. Totally frictionless. And here's the, yeah, sure.
All right. So like he said, there's an audience participation part. So back to Doug Horner, when he first started WebChart, and he was talking to me about BlueHive, his quote to me was, give the product away, because when they use it, they're going to love it, and they're going to stay, and then they're going to want to pay. Well, I figured I'm going to step it up even further, not just give it to you for free, but actually pay you to use the product. So for everyone who is participating today, you will qualify for, like I said, it's a free trial. There are no strings attached. Now, I know everybody isn't going to be, I know everyone didn't raise their hands around it, but what we would like to do is have everyone either pull their phones out or their laptops. We are going to pay you $25 to actually just log in and put your information in. And the person who does it the fastest, so we'll start kind of like the countdown, and whoever says bingo first gets $25. If you stay on the platform and you put an order in April, you will get $250. Now, this can come in two forms. One, it can just come in a simple credit card that you can use and buy yourself something nice. Or, like some that we've talked to, you really can't do that, so it'll just be a $250 credit to your account. Also, for every order that you put in for April, and you would qualify for this too, on the, not the 25 you're already in, but the $1,000 giveaway. For every order that you put in for April, that'll count as an entry for a $1,000 giveaway. So that's where you see the $1,000. So if you put in 10 orders for the month of April, you'll get 10 shots at $1,000. Again, that can come in the form of a credit card or simply a credit to your account. And really the goal of this is for anybody who really does have a need for this to try it out and see if it actually makes your life easier, because we're going to bet that it actually does. And if it doesn't, then you just cancel, and we can even convert that credit to a credit card if you want, like a gift card, not a credit card. You're not passing a credit check or anything like that. It's just a gift card. And then like I said, there's no penalties, no anything. It's really a no-lose situation, all-win proposition. So if everyone would like to pull their phones out or laptops out and go to the blue, I don't know. Walk them through this. Do we have a QR code?
And then if you scroll down a little bit, there will be this employer portal button. So if you click on the employer portal button, that will get you to where you need to go. And then if you click log in with BlueHive, that will redirect you to be able to log in with either Google, Apple, or Facebook. If you don't want to log in with those, you can click log in with email and hit register and go through that process. I would recommend logging in with either your Apple ID or Google. Just hit those buttons because that's the simplest way to get in. And then once you've gone in through there, that should sign you up to the part where you onboard as an employer. And if anybody needs help, please let me know.
Yep. So like I said, we don't want you to do this, but you can earn $25 right now. And then if you walked out of here and canceled it, you'd still have $25. So $25 to log in, and then are we going to start the clock? And whoever, no clock? All right. Clock's running. All right, we'll start now. So whoever gets logged in first wins $25. Just say bingo. Was this on your bingo card today? That's the new saying for 2025. Not on my bingo card today.
Bingo.
Bingo.
All right. So you got to go all the way through the onboarding process. If you're downloading from the Apple Store, make sure it's BlueHive for Employers. If you download just BlueHive.com, that will be the wrong app. You want to download the BlueHive for Employers app. Need some help?
No, I work for my clinic, so I'm not going to do that.
Okay.
But I will have a lot of questions.
Yeah, we will have a Q&A session. So you got to get all the way through this onboarding.
All right.
right, so you won the $25. So you'll get 50 today, and everybody who signed up gets $25 today. So do we have the necessary information to give everyone the $25 who signed up? Because it's going to come in an Okay. So just if you're fine with the credit card, that's easy to do an email. If you said, hey, I'd rather have it as a credit to the account, just let us know. So this is the Q&A portion of the presentation. Do we have any questions? Oh, yeah, yeah. Let me give you the microphone.
Yes, if I've got negotiated prices with a provider, how does that flow through to the system?
So depending on the provider, we will work with you on your fee schedules and making sure that you get the same pricing that you have with the provider. I believe we've done that with Blue Jacket, so we can make sure that that information gets passed over. So if you already have an existing relationship with a provider, you can say, hey, I'm using BlueHive now, and just get us that information, and we'll make sure that that pricing is respected.
Yep. And the other part I wanted to mention, again, everybody who's trying this out will just be on the $0, so obviously you're not paying us per month. And as you're trialing it out, what we're trying to figure out is what are you going to end up spending? And what we don't want to do is have you spending more than you're spending now. So that's where this like effective communication is going to come into play. And Jacob knows we're very strong communicators right now because we really want to, again, make sure we're not, the whole idea is to provide value but not have you kill your pocketbook for it. So as you guys are trying this out, we are going to check in, make sure that you're paying what you would normally pay for these services, but getting more value. So keep that in mind as we're doing the pricing structure. And even though you saw there's a pricing matrix there, there are companies that are past that $1,000. So what I would call that is if someone's like, hey, I want that transaction fee lower, we are entertaining enterprise level agreements. That's the only time we may get into an agreement structure, and that's because you're obviously doing so much that, you know, it makes sense to continue. So that would be the only caveat as far as contracts would be an enterprise level agreement.
And at that level of orders coming through, you know, we'll have SLAs and things in place because that's, you know, we want to protect you as well as the employer, making sure that we can, you know, fulfill those orders. So depending on the volume, if you do have a large volume of orders, we might need to, you know, hire another person that, you know, helps dedicated making sure that we have an on-call staff for that period so that those orders get fulfilled. Cool. Yep. Any other questions? Did you get all your questions answered? Okay.
Yeah, we're setting a meeting with her.
Awesome.
Yes.
Awesome.
Yeah, I just had to piece some things together. I'm like, okay, so, yeah, he's gonna email me.
Amazing.
She said it was, I just want to
I said it was a wonderful system, because we have like.
Yeah. So can you say that one more time, please, for the live stream?
I said it was a nice system, so.
Awesome.
Yeah. Oh, that was.
I know, it's like.
Drop the mic.
Yeah.
All right. Any other questions? Well, again, want to thank everybody for coming. Please feel free to reach out to any of us at any time. You'll definitely be getting a follow-up email. Please feel free to take any food home. So if you want to take a donut home, you want to take an extra plate of spaghetti home, definitely
tons of
do
coffee
that. There's
too,
so much,
so.
yeah, so much food. But again, thank you for showing up and listening to our demo. We appreciate it very much.
Yeah. And one of the plans for this event, you know, we're going to probably do one of these like once a quarter, you think? And we're also doing a lot of other like NYRA events. We want this to be a place that you can feel like, oh, this is, you know, somewhere I want to come and hang out, somewhere to, you know, invite your friends to. You know, not all of these events are going to be, hey, sign up and use the product. We're going to be doing other lunch and learns for different things and making sure that, you know, this is a good experience for HR professionals in the area. So hopefully, you know, you enjoyed it today and learned some things today. We're really just trying to build, you know, this sort of collaborative group of, you know, like-minded HR professionals that if you have ideas on how we can simplify your workflows, make your lives easier, you know, if you have issues, you know, please communicate with us because we really do want to make a dent. We really do want to make a meaningful change in your workflows, in your lives. And, you know, if there's a time where you're just like, man, this is painful, or I wish this could be automated, let us automate it for you. Let us try to make your lives easier. So thank you so much
And
for
I
coming.
do want to thank Naira for bringing some goodies. Thank you, Brittany. We created a goodie bag, and she made it even better. So I wanted to say thank you for that.
Thank you so much.